Hello and welcome to Pregnancy Info. Today we will discuss about the care in first trimester of pregnancy. This is very crucial to understand that what should you do or do not do in the first trimester, or what are the cares you have to do in this trimester. Now the question is that what is the first trimester? A pregnancy lasts for about 40 weeks. The weeks are grouped into 3 trimesters. The first trimester is the time in between fertilization of the egg by the sperm and week 12 of a pregnancy. A woman's body goes through many changes during the first 12 weeks of a pregnancy. Women often start to have concern over what to eat, which types of parental tests they should consider, how much weight they might gain. They can make sure their baby stays healthy. So, understanding a pregnancy week by week can help you make informed decisions and prepare for the big changes that lie ahead. What happens to women's body during the first trimester? There are some common changes or symptoms a woman can face in the first trimester, like tiredness, upset stomach, throwing up, mood swings, tender breasts, heartburn, weight gain, headache, craving for certain foods, revulsion to certain foods, constipation, etc. Some major changes we will discuss the fetus have in this trimester. The first day of your pregnancy is also the first day of your last menstrual cycle at about 10 to 14 days after an egg is released. Combines with the sperm and conception occurs, a baby develops rapidly during the first trimester. The fetus begins to develop a brain and spinal cord, and the organ begins to form. The baby's heart will also begin to beat during the first trimester. Arms and legs begin to bud in the first few weeks, and by the end of 8 weeks, fingers and toes start to form. By the end of the first trimester, the baby's sex organs have formed. According to the Office on Women's Health, the baby is now about 3 inches long and weigh about 1 ounce. What can be expected at the doctor? During your first visit, a doctor will take a full health history and perform a full physical and pelvic exam. The doctor may also perform an ultrasound to confirm the pregnancy, perform a pap test, take your blood pressure, test for sexually transmitted infections like HIV and hepatitis, estimate your date of delivery or due date, which is around 266 days from the first day of your last period. Screen for risk factors like anemia, check thyroid levels, check your weight. At around 11 weeks, the doctor will perform a test called neutral translucency scan. The test uses an ultrasound to measure the baby's head, and science can also determine the chance that your baby will be born with a genetic disorder known as a Down syndrome. How can I stay healthy during the first trimester? It's important for a woman to be aware of what to do and what not to do while pregnant in order to take care of themselves and their developing baby. First, we will discuss what to do. Here are some personal health measures to take during the first trimester, like take prenatal vitamins, exercise regularly, walk out your pelvic floor by doing Kegel exercises, eat a high diet in fruits, vegetables, low fats, forms of proteins and fibers, drink lots of water, eat enough calories, about 300 calories more than normal. Now, what to avoid or what not to do? These things should be avoided during the first trimester. Strenuous exercises or strength training that could cause an injury to your stomach, alcohol, caffeine, smoking, illegal drugs, raw fish or smoked seafood, shark, swordfish, mackerel or white snapper, fish that have high level of mercury, raw sprout, cat litter which can carry a parasite disease called toxoplasmosis, unpasteurized milk or other dairy products, deli meats or hot dogs. What else should be considered during the first trimester? Body changes provide plenty to think about during the first trimester, but having a baby will affect other parts of your life too. There are many things to start to think about during the first few months of the pregnancy. You can prepare for the future. Want to tell your friends or family members and employers. The first trimester is the most common time for a loss of pregnancy or miscarriage. So you may want to wait for the pregnancy to settle into the second trimester. You may also want to consider whether or not you will keep working or quit your job as your pregnancy progresses, and if your employer provided unpaid maternity leave for the birth and care of your newborn. Where you want to give birth. You may want to start to consider where you would like to deliver your baby when it's time to give birth. Women can choose to deliver at a hospital, birth center, or at their own home. You should weigh the pros and cons of each location and discuss them with your doctor. If you have a high-risk pregnancy, that means there is a greater chance of complications. Factors that may make your pregnancy high risk include being young, being over 35 years old, being overweight, being underweight, having high blood pressure, diabetes, HIV, cancer, or other autoimmune disorders, being pregnant with twins or multiples. Women with a high-risk pregnancy may need to visit the doctor more often and sometimes may need a specially trained doctor. Having a high-risk pregnancy doesn't necessarily mean you will have any problem. Paying for care. Many women worry about the cost of medical bills during a pregnancy. The good news is that there are options available in every state in the United States to help pay for care. As soon as you find out you are pregnant, you should make an appointment to see your healthcare provider, a midwife, or a physician. Health insurance options have changed over time, and most offer pregnant women more options. Insurance companies are learning it is important to provide prenatal care to prevent more expensive medical care later. Local hospitals, clinics, and other government programs are available to help you with food, nutrition, counseling, and free access to health services for pregnant women. Hope I have explained all the maximum cares and pros and cons and do's and don'ts of your care in first trimester. So if you like the video and find it useful, then you should share it with your family members or the women who are pregnant and need this information. And also subscribe my channel to encourage me to make such kind of useful videos for you. Thank you.